This is kind of a broader question, but how do you define autism?
Good question. So, there's a bunch of criteria for autism. It's mainly like a checklist. Has a lot to do with communication, repetitive movement. So, there's a long list of that, which we can post later this week on Instagram via carousel. But in my opinion, it's more of a symptom. Like let's take a cough for example. We have a cough, and that can be the diagnosis temporarily. But what's causing it? Is it bronchitis? Is it emphysema? Is it asthma? We'll have to look into the deeper cause of what that cough is coming from, and then treat it. Once you treat that underlying issue, those symptoms like cough get better. So for autism, we use mainly the diagnosis of autism using that criteria, and you don't need to meet a lot of things on that list to get the diagnosis. But the next step is looking at genetics. Looking at, I have a patient that has 1P deletion syndrome, a patient that has Fragile X, a patient with Down syndrome, different genetic disorders that have autistic features in autism. And then those with epilepsy, you can have so many seizures that you have difficulty with communication and thinking. And then imaging, you need to look at the brain, make sure that it's normal. If there's a missing corpus callosum, which is the part that links both sides of the brain, you're going to have developmental delay, autistic features. So that's a really tough question for me because I can go on and on and on, and I usually do in the visits, explaining to parents, what, autism is okay. I have a lot of autistic features. It's not necessarily, I think it's a superpower, and we all communicate in different ways. So it's not a bad thing, first of all. My main thing is, how do I get this individual to be their best self in life? I think that's what we have to focus on. So the list, everybody focuses on the list. I can sit here and read, you got to have this, you got to have this, you got to have this. But, I'll get a lot of parents responding saying, well, now what? Mm-hmm. So autism, no autism, you got to really optimize what we do in life.
Yeah.
I agree.
Yeah. Yeah. I can go on and on about this. This is something that's really dear to me because even just on Instagram in general, we'll talk about developmental delay, like a kid not walking at, 18 months old. And then there's so many comments about, hey, starting ABA, starting this, it's autism. I think we got to back up. We're talking about a kid not being able to walk. Mm-hmm. So we got to make sure that the brain is formed correctly, the spinal cord is formed correctly, get them in the right therapies, like physical therapy. If they have behavioral stuff, definitely ABA, but I don't think everything just fits into autism. And I think that's what everybody's trying to do, is just lump everything into one. Mm-hmm. Let's really individualize every person and just help that person.
Yeah, there's patients that have developmental delay that don't have autism. So they're independent of each other, but like you said, they tend to get lumped together a lot of the time. So developmental delay can mean a lot of different things, and it could just be a motor delay, right? Which is like the not walking. And that's independent of, speech and fine motor skills. So there are a lot of different aspects, and having, a comprehensive evaluation is important, but finding the underlying cause, right? It's a symptom, not necessarily a diagnosis in and of itself, even though that's how it's treated. Yeah. But what's the reason? What's the cause for that?
Yeah, and I always get a lot of good information or good feedback whenever I say it's not a diagnosis. I mean that in a positive way, in I'm sticking up for you kind of way. Don't let someone just say it's autism and go get therapy. Like, that's wrong. They can say that so you can get the therapies, because insurance requires the diagnosis of autism to get certain like ABA therapy. So it's an insurance-driven thing to get it really early. But I'm still going to use the next year to figure out, hey, what's the specific thing that's causing it? Mm-hmm. So yeah.
A lot of stuff we, used to never be able to have a reason for the underlying cause. And now with advances in genetic testing, especially, there's so many just genetic disorders that cause autism, or subsequently the child has a diagnosis of autism, but really it's the genetic disorder that is causing it. So genetic testing in and of itself has like come so far in the last 10 years, and it's advancing exponentially. So we'll hopefully get more answers, but.
And then there's so many adults, let's say young adults that have been diagnosed with autism that have never had genetic testing. Mm-hmm. They've never had an EEG.
Yeah.
So how many of those individuals have seizures every day that no one knows of? And how many have a genetic abnormality that is, we can find it now? And if we find it, the next question is, what can you do with that information? Mm-hmm. And I agree on that. Like, I've had a parent tell me, I don't care what the genetic etiology is. Hey, that's fair. But what if it's a genetic disorder that has a treatment? Mm-hmm. Even if we're 30 or 40 or 50 years old, I know that parent would want to try if that treatment was available. So it's about focusing on making that person's life the best possible with the current treatments and technology, and then collecting data for the future.
And along those same lines, like those patients potentially that have these genetic disorders that they find out later in life can have associated heart defects or things that they wouldn't have known had they not discovered that they had this particular genetic disorder or syndrome. And then Sean makes it a point to go back. Patients who had genetic testing 10 years ago, 15 years ago, and they found nothing, they should have that repeated because genetic testing has come so far. And repeat EEG, just a whole workup repeated. I think you usually do 10 years. Yeah. So just there's a lot of things that have advanced, and you could find an answer now that didn't exist back then.
Yeah, never give up looking.
Yeah.
I have patients that I saw, when I first started in 2010, 11, 12, that we just found the diagnosis a couple of years ago, whether it be 7 years, 8 years. But now we have the diagnosis. It's, they had autism. That's the diagnosis initially. But now this is a 12-year-old with Fragile X, and he's going to do great. But now we know behavior is going to be a big concern. There's going to be some learning issues. But in terms of like running and all that kind of stuff, he's going to be pushing the envelope at home. So I think just knowing what the etiology is progress. Mm-hmm. It's not the answer. Mm-hmm. It's like, what do we do next? And then, I just keep going. And then if you know the diagnosis, you can start linking with people across the world that have kids with the same diagnosis. Mm-hmm. When you start putting parents together, let's say that one person has Fragile X, and then you go find all the parents, like a group, like a Fragile X parent group on Facebook. Getting on that and knowing what worked, what didn't work, what treatments are there, what researchers are there, that's where the value lies. That's where parents are going to feel supported. Coming to the doctor's office, I think, is scary and annoying in a way, and I mean that respectfully. But when you're talking to a group of parents that have been through that road, it's so much more comforting and hopeful.
Mm-hmm. That support network is so important.
Yeah, and I can talk about this for at least 24 hours. So this is a big thing of mine, and not everybody agrees with what I say, and some people are like, yeah, say more of it. So I would love to unite everybody into one process and thinking, let's help each other. Let's stop getting on each other for saying different words that mean the same thing. And there's a lot of parents that are scared to say something on social media or in out loud because they're afraid of saying the things the wrong way. But I'm here to say, let's get everybody together so that we can push on everybody else together. Mm-hmm.